Now, I want you to imagine yourself in a hospital. You are feeling so bad and tired. You don't even remember how long you have been waiting for. You keep looking at the clock. A baby is crying. Many people are complaining. You ask yourself why wait times in hospitals are so long. This situation probably sounded very familiar, especially if you're living in Ontario. Long wait times can leave patients with serious consequences such as increased pain and suffering, mental anguish, and long-term risks. After COVID, our healthcare system is still struggling to get back to normal. According to government documents, almost half of the patients on Ontario's surgical waitlist were forced to delay longer than doctors would recommend, a 123% increase compared with pre-pandemic levels. In early 2022, the number of patients waiting longer than recommended sat at 105,000, according to the data compiled by the Ministry of Health. But in 2019, an average of 47,000 people on Ontario's surgical list were waiting longer than clinical guidelines for their procedure, representing 23% of the total number on the surgical wait list. By 2022, the number of long waiters grew to represent 43% of the 250,000 person waitlist, according to ministry documents. You might be asking why and how waiting times for surgeries increased that much. Well, it's partly a factor of hospitals catching up on surgeries postponed during the worst waves of pandemic. But this is not the only problem. The healthcare system needs many changes. People who work in healthcare in Ontario say the key solutions to elevating the pressure on emergency rooms don't involve quick fixes, but rather long-term changes to the system. Other than the wait lists for surgeries, ER wait times are dangerously getting out of control. According to data, just 23% of patients were admitted to hospital from the ER within the provincial target time of 8 hours. In one instance, a child with pneumonia waited nearly 40 hours in ER. But as there is a solution to every problem, there are possible ways to lower waiting times. To solve the problem, let's dive deeper into it and its causes. Right now, the supply of surgical services is insufficient to meet the demand in a timely manner. You can think of hospitals like businesses. Normally, in a business, if demand is high, quantity will also increase because more people want the product. Unfortunately, hospitals fail to do that and limited products are not enough to meet people's needs. A lack of skilled staff, especially nurses, is one of the biggest contributions to ridiculous waiting times. An even larger problem is the lack of coordination surrounding specialized healthcare in Canada. Many people are unaware that most specialists, including the vast majority of surgeons, are in effect operating their own small businesses. Since hospitals are not doing a good job on guiding patients, long wait times occur for specific doctors. A common way of reducing unnecessary variation and long wait times is the use of single entry models, where patients are seen by the next available provider, doctor, just like a bank or a telephone quack for customer service. These models have enormous potential to reduce wait times. Huge investments have been made by Ford's government, but nothing seemed to have made a big change. Many political parties have different plans to reduce wait times, and almost all of them prioritize this issue. But we will see what happens in the next elections. The healthcare system causes long wait times, but they also have some contributions too. 1.3 million Ontarians do not have a family doctor, and people who don't have a family doctor are more likely to come to the emergency room for care than those who do, resulting in high wait times in ER. So, if you don't have a family doctor, get one. Hopefully, some efficient and beneficial steps towards solving this problem will be taken, and we wouldn't need to worry about waiting in hospitals anymore. I wish all of you healthy days where you don't need to go to hospital and wait for hours and hours.